Hello, dear students. You're welcome to today's class. And like you all know, we are starting with the first topic. And the first topic, which is under the general topic, health program planning and evaluation. And so the first part one of this particular course is program implementation and management function. Program implementation and management function. My name is Dr. Henry I. Saboin, and so I welcome you to this class, and I want to assure you that by the time we are done, you would have a good understanding of program implementation and management function as regards health programs. Very important as regards health programs. So follow me as we look at the details that we'll be discussing in this particular topic. We'll be looking at the principles of health program management, and then we'll be looking at organizing. What does it mean? Why is it important? Staffing, directing. We'll be looking at the act of controlling. How do you utilize it when it comes to program implementation and management functions? Leadership in program delivery. What role does leadership play? How is leadership organized? And how is leadership, utilized? What are the kind of leadership that you find in public health or in general? But in this case, as to how we can apply it to program delivery. Now, this is the course title and the scope that we'll be looking at. In this course title, you will see that we have PHS 311. We'll be looking at, like I said, program implementation and management function. Here we'll be looking at the principles of health program management. What are the principles? We will then look at what are the core management functions that are needed, that are expected, very key in ensuring, program implementation. We will then look at leadership in program delivery. What does it mean? And then we'll look at Nigerian public health, program examples. There are many programs that have taken place in the past. Some are taking place as we speak. As a matter of fact, programs upon programs are being implemented at different spheres, different areas for different purposes, and with required different outcomes. And so we'll be looking at all that. Now let's look at the objective. Let's look at the objectives. But before then, when we say implementation, a public health program is not judged by the beauty of its written plan. You need to know that. But it is judged by what actually happens in communities. Children getting vaccinated, mothers attending antenatal care. For example, malaria cases, every time we fight to ensure that they are reduced. HIV virus suppression, we want to ensure that it is improved. And these are the footprints of implementation here and there. And many programs fail not because the science is weak, but because management is weak. Implementation is where theory meets reality. And reality is often sometimes very messy. Messed up. Sometimes it becomes political. Sometimes you find that it is underfunded. And sometimes you discover that people get emotionally charged. And in some cases, you find out that there is logistical constraint. So that is why understanding and management functions of organizing, staffing, directing, controlling, and leadership is absolutely essential for anyone who wants to succeed as a public health practitioner. So today, we are going on a full journey, and I want you to go with me. I want you to pay attention. We'll be beginning from definition to detailed management functions, and we'll look at relevant Nigerian examples to a real case scenario that mirrors exactly what happens in the field. So I'd like you to settle in. This will be a deep one, but it will be a complete lecture. So what are the objectives? We'll be looking at number one. We'll be explaining the meaning of program implementation in the public health. We'll also discuss the 4 major management functions, which include organizing, staffing, directing, and controlling. Number 3, we will describe the leadership principles in program delivery. We'll also apply management concepts using Nigerian examples. And then we will analyze effects of poor management on program outcomes, and then we will interpret a practical implementation case scenario. We'll look at a case scenario, interpret it, and we'll look at what were the implications of the practical steps that we're taking. So let's start with the definitions. When you say program implementation, what does it mean? Program implementation is the operational translation of a program plan into concrete action. It is the operational translation of a program plan into a concrete action. So if planning answers what we want to achieve, implementation answers how we bring it to life. So if sitting down to plan will determine what we are going to achieve for any program in life, it also means that the implementation aspect of it will bring that planning, will bring that intentional, arrangement to life. And this includes that we are going to mobilize personnel, we are going to be releasing resources and logistics, we will be, coordinating stakeholders, different parties, different persons that will be involved in carrying out the implementation exercise or the implementation of that particular program that has been designed and planned. It also means that we have to maintain supervision, because having started, we have to look at what is being done, ensure that it is being done according to the plan, ensure that nobody is going out of the speculated strategy laid down or plan laid down. And that means that we'll be communicating the updates. So the next one is that we'll be communicating updates. We have to be communicating to the superior, telling the superior what is going on at the grassroots, where we are now, what we are doing, how much ground have we covered, and what are the challenges that we are observing. Are there any issues or any problem? We have to communicate on a daily basis. It doesn't matter how many times, but when there is a need, that communication must be updated. The next one is that we must, ensure that when there is a need, we adjust our strategies as the reality unfolds. We have to adjust our realities, our strategies, as the reality unfolds. For example, writing increase immunization coverage to 90%. That is planning. When you write on paper, increasing immunization coverage to 90%, that is planning. Yes. Now, when it comes to hiring vaccinators, transporting vaccines to the LGAs, that is the local government areas, going beyond there, we also engage community leaders to let them know what we want to do in their community, and then conducting outreach sessions. All these acts is what we now know, or what we can call implementation. So implementation is where most public health programs either thrive or they fail. Having written it on paper that we want to increase immunization coverage to 90%, that at that point is only planning. That is planning. Yes. But when we go out now to implement, we can only successfully implement when we start hiring vaccinators, transporting the vaccines to the local government areas, according to what we've written, the things that will help achieve what has been written. Those things are simply the act of implementation, and that is where most public health programs failed or they succeeded. Now, when we say program management is the structured process that helps a public health team coordinate all the activities necessary for implementation. It uses the classic management cycle, which include, number one, planning, which is the beginning of the process of implementing any program. You have to plan first. And after that, number two, we organize. After that, we begin to staff. Who do we need? Human resources. We begin to employ them. That is staffing, bringing the right hands together. And number four, we begin to direct. Do this way, do that this way. This is what you ought to do. This is what you ought to do. This is the scheme for you. This is the job schedule for you. Everybody knows what is expected of them, what they are to do. Now, after you have given the proper direction, everybody now have their job schedule. The next thing we talk about is controlling. So you need to now control the affairs. In implementing, there is a need to do a lot of controlling, a lot of guidance, a lot of counseling, ensuring that we stick to the plan. So program implementation is very important. But in program management, here the full management cycle is brought to bear. So program management ensures that all these pieces that we've mentioned in the management cycle, that all these pieces work together harmoniously. Now, a simple way to remember it is simply by saying planning gives vision. So when you plan, you can see what the outcome will look like, what you are expecting, what you are hoping to get as you put the pen on paper and you are planning. You can also remember it this way. Organizing gives structure. When you now go beyond the paper to begin to organize who does what, who gets what, and to what extent does what, come or is put in place, that ensures that you begin to organize, and the organization will bring about a good structure. Another way to put it, you can remember it by simply saying staffing gives capacity. When you bring the right people, remember you are bringing them, employing them based on their capacity. They have the wherewithal, they have the capacity, that's the degree, the knowledge, the skill to be able to carry out that job. They've been trained so that when they get into the job, they can apply the knowledge that they already have in ensuring that the job gets done. Then finally, you now direct. So directing gives momentum. When you are directing, you are telling each person, this is what you need to do, this is what you need to do, this is where you need to go, this is how you go about it. So this is very, very, very important. Also, you are controlling. So when you control, controlling gives accountability, because when you control, you want to get feedback. And when people give you feedback, it's a form of accountability. What I asked you to do, have you done it? How have you done it? What has become the outcome of what you have done? Have you been able to fit into what we actually wanted before we set out to do that job? Without this, the most brilliant program cannot deliver any results. So planning gives vision, organizing gives structure, staffing gives capacity, directing gives momentum, controlling gives accountability. accountability. So you see that program management ensures that there's alignment of resources with the activities. So there are clear roles, effective supervision, and early correction if there's a deviation. And we can see that this has been used in many high-performing organizations like the WHO, the UNICEF, the NMEP, and then the State Ministry of Health, and all of them rely on a good structured management framework. So next we'll be looking at the principles of public health program management. There are principles upon which public health program management functions. It doesn't just function as it were. It doesn't just operate for itself. It is certainly on certain principles. So let's see these principles. Number one is efficiency. Efficiency. Like I said, remember, public health program management is anchored on foundational principles. And these principles, they guide every action. Number one is efficiency. Efficiency simply means achieving maximum results with minimal waste. Very simple. Achieving maximum health impact with minimal resources. In a country with constrained budgets, efficiency determines whether a program reaches 10 words or 100 words. So how you go about it will determine. Because remember, for example, in Nigeria, like in most other countries, there is limited funding and competing, priorities. And so you are given a little allocation to ensure that you get the job done. So how efficient you are will determine whether your program in implementation will reach 10 words or it will reach 100 words. It all depends on how you have been able to determine the scale of population that you are dealing with and how you are able to determine the distribution of the resources and how you are going to ensure that you sustain the intervention. Now, all this borders on your efficiency. The next one is effectiveness. Effectiveness. This is the degree to which a program achieves its intended health outcomes. For example, HIV programs are effective only if viral suppression improves. If we carry out an HIV program, the essence is to ensure that those who are HIV positive, the viral load is suppressed, and so their health improves by checking their CD4 count, and they are taking their drugs, and that way the viral load is combated, reduced, and then the CD4 count goes up, and then you see their health improving. So this is about producing the intended health outcomes. Another example is a malaria program, which is effective. And it will only be effective when the malaria incidence actually reduces. So when we look at this particular area, the incidence of malaria infection as at last month was 70%. But this month, we discover that when we kicked off the malaria program as at the 1st of this month, and by the time it is 30th of the new month, the incidence of malaria has actually reduced. So that is effectiveness. The next one is accountability. Accountability. That is the responsible and transparent use of public and donor resources. How are we using the public and donor resources that have been put into our care? That's accountability. And this includes you carrying out budget accountability. That is, you put a record of day-to-day spendings, the millions that you have been given to carry out that project. You must have records. what was spent, how was it spent, the receipts received, and what products have been received, what products have not been received, and how are they being used. That is the way you supply them, you track it. The staff payment, the staff time, you monitor them. And what are the benefits of accountability? It will build public trust because you review your cost of budget monthly or quarterly, and you make it known to the public, telling them your tax earned money that we received and was allocated to us. This is what we've been able to do with it. This is what we have achieved with it. Balance. And this is what we intend to do. You earn that public trust, and this will strengthen donor confidence, and you find out that those who have donated in the past will be willing to keep donating. Why? Because they have discovered that you are really putting that money to use. You are using it properly, and you are giving good account of what you are receiving. The next one is coordination. The next one is coordination. Now, when we say coordination, it simply means alignment of multiple stakeholders, like the government, like the non-government organizations, donors, and communities. You find a way to make sure that everybody is carried along. You find a way to make sure that the government is carried along. The NGOs who are partnering in this project, it may be more than 1, 2, or 3, you ensure that every one of them is in the meeting where the reports are given. If there's a memo, there's a letter written, you make sure that all of them gets the letter. The next one is the donors. You ensure that the donors are carried along. They get the right report at the right time and the right place, and also the community. You put the information on the notice board is a way of coordinating them for meetings, giving them that confidence, giving them that assurance that indeed their resources is in the right hand and the project is in the right hand and is delivering the right results. And in coordination, you want to prevent duplication. You want to prevent resource wastage. And you want to ensure that there are no interagency conflicts where two NGOs begin to have challenges because they feel that this other person is doing their job and I should be the one doing this. So you ensure that you give clear directive such that this NGO knows what to supply, this NGO knows their just schedule, and this NGO does its own, and everybody plays their part. There is no overlapping. Because when coordination breaks, duplication will increase and conflict will rise. The next one is equity. Equity. I'm sure you are taking down notes of all these principles. For equity, this is ensuring services reach all population groups, and it focuses on rural communities, all the marginalized populations, and those ones that are hard to reach groups. And so equity ensures that all population groups benefit fairly from services, including rural communities and the urban poor. So equity is very important. Let everybody feel at home. Let everybody own the project. Let everybody have a feel that this project belongs to us all. The next one is sustainability. Sustainability. Now, this is about ensuring that programs continue to function even when donor funds have reduced. You see that even when the donor funds have reduced, you want to ensure that this program must not die. So sustainability depends on community ownership. You've been carrying them along. The community now understands that there isn't much fund. and they are willing to join hands with you who is implementing the project. They see it as their own, and they feel this project must not go down. Sustainability depends on community ownership, local capacity, and also government commitment. So these principles shape everything from budget allocation to supervision to evaluation. So when the budget is allocated, the principle will shape it. Down to where supervision will take place, these principles will still be available to shape it. And also down to when the job is completed and we're evaluating if the job was well done, principle will still shape it. So it is important that you understand this. These principles are very key. Now, having talked about these principles, it is now time to talk about management functions in public health program implementation. Management functions in public health program implementation. What are those management functions? And how do we employ them? So, at this juncture, we are diving into the core of this lecture. And we want to see the 4 classical management functions. 4 classical management functions. And these are not abstract theories. They are practical. They are real-world tools used by the Ministry of Health, used by the World Health Organization, UNICEF, and local government health teams daily. And I also use them in majority of projects that we'll engage in. And so we are going to look at them one by one. Now, before you is a chart. The diagram here shows management functions in program implementation. Here you can see program goals here. And then here you see that under the program goals, you are going to organize, and that is the structure. Staffing, that you get people together that will work with you. Directing, you need leadership roles. People who will be in position to ensure that things are done properly. And then we need to do controlling. The act of controlling, which is to ensure that we monitor. A, you are going beyond the scope. B, you don't seem to be catching up. Why don't you double up your effort? C, well, you have done well, but you missed out a particular measurement. You see that? That's monitoring. Seeing to the fact that what was initially planned is what they are doing. They are not going beyond it, and they are not going below it. They are delivering according to plan, and that is success. So we will begin by seeing these management functions. Number 1, organizing. Number 2, staffing. Number 3, directing. And number 4, controlling. I'm sure you are taking notes, because as simple as this course may be, the questions will come from this dimension. And like I've always said, it's either you know it or you know it. But if you don't know it, you have yourself to be blamed, because these have been clearly stated out before you. So, management functions: number 1, organizing. Number 2, staffing. Number 3, directing. Number 4, controlling. Now let's take it one by one. Organizing. Organizing is the function, it's the foundation. Yes, let's put it that way. It's the foundation of implementing or carrying out implementation. So we can say it's the foundation of implementation itself. It is the process of arranging resources, activities, and people in a structured way to achieve program goals. Now, you think, or let's put it this way, You can think of organizing as building the skeleton of a program. Yes, let's think of organizing as building the skeleton of a program. Key activities in organizing, developing organizational structures. We have to look at that now. What are those key activities in the process of organizing, in the process of developing organizational structures? In Nigeria, this typically includes, number one, national level. You must take note of that. These are the major structures when you want to organize. You must take cognizance of what? The national level, state level, and the local government area level. Of course, you know those are the three sections in governance. Now, under the national level, you are to take note, of policy and leadership, of policy and leadership. That's what you have at the national level. That's the structure at the national level. Policy and what? Leadership. Number two is the state level. That's where you find coordination and monitoring. Coordination and monitoring. Then at the local government area level, you will find implementation and community engagement. Implementation and community engagement. Now, from the local government area, we now come to the council area. There, you will find the facility level. That's where the service is being delivered. That's where the service is being delivered. So, this ensures that there is clarity from the top to the bottom. So at the level of the facility, service is being delivered. Role allocation is carried out. Logistics is carried out. And so on. So there you establish the rules. At this juncture, every officer must know, because you're establishing rules and responsibility at the level of the facility now. Every officer must know what are they doing, or what they are to do, or what exact program is going on. Why they are doing it, they need to know. They need to know. When it must be done, they need to know. And what resources are available. That's how you establish the rules and responsibility. That's number one. Number two, we now go about resource allocation. Resource allocation. This is where you now distribute the funds, equipment, reporting tools, coaching equipment, transportation, and supplies. This is where you now distribute all these things. Remember, number one, at the facility level, you must establish the rules and responsibility. Let every officer know what they must do. Number two, you now carry out resource allocation. This is where you distribute fund, equipment, tools, coaching equipment, transport, and supplies. Then number three, we carry out coordination mechanisms. Coordination mechanisms. And this include the technical work groups. You bring them together so that they know what they are going to do. Then also emergency operation centers, national steering committees, partner coordination meetings. They prevent fragmentation and ensure that all stakeholders, they move in the same direction. So this is very, very important. And you must ensure that you put this in place. Remember, number one, at the facility level, you establish the rules and responsibilities. You ensure that there is resource allocation, and then there is coordination mechanism. We move further to look at an example. Now, in this example, under organization, We look at an example in Nigeria. There was a program called MEP, the National Malaria Elimination Program. Now, it was organized into vector control, that is to control the mosquitoes, to diagnose and treat, and also to supply mosquito nets and drugs, and then to carry out monitoring and evaluation, and also to do some advocacy, educating the people so that they believe in the government and they carry out instructions that will prevent them from being bitten by mosquito, especially the pregnant women. They did all this, and what was the lesson? Clear structure we observed, improved coordination, and it reduced duplication. So you didn't have 3 people doing the same thing. Coordination was 100% smooth, and there were no duplication as much. So they were all working together and ensuring that there is success. We move to the second part under the structure, which is staffing. Staffing. That's when you bring people together to carry out a particular task, because you cannot do it alone. So staffing ensures the right number of people with the right skills, ensuring that the right number of people with the right skills, that they are in the right position at the right time. The right number of working staff having the right skills are in the right position at the right time. No matter how well the program is organized, without the right staff, implementation will collapse. So the key component of staffing, number 1, is recruitment. So how do we now do staffing? Number 1, we have to do a recruitment exercise. This is where we hire staff with appropriate qualification: medical officers, nurses, public health officers, medical lab scientists, environmental health officers, district nursing officers, and so on. Now, after you have carried out number 1, recruitment, number 2, you carry out training and capacity building. Training and capacity building. Training and capacity building. For example, WHO malaria microscopy training is one major training they do in the bid or effort to eliminate malaria from Nigeria. So certain number of volunteer or applied medical lab scientists are taken to Abuja for a 1 week's training, and they are taught on how to identify schizoids, merozoites, trophozoites on the microscope so that they can identify malaria properly. Also, we have integrated supportive supervision training. That is, you take a group of people, integrate them into a program, support them, and then you supervise them. And we have other programs also, like the epidemiology micro-planning training, where people are trained on epidemiology, roles they play in epidemiology, and how they can support in, disease breakout. Maybe there's a pandemic in a country, like we have COVID-19 pandemic at the time, or Ebola at the time. Now, number 3, after you have recruited them, you have trained them. Number 3, motivation and retention. Motivation and retention. Now, this includes recognition, that you recognize them. You recognize these people. When you employ them, you train them, you motivate them by recognizing them, giving them supportive supervision, ensure that they have career progression. They can be promoted from one level to another. You ensure that they are what? They have career progression. You pay them on time. Make sure their allowances come when it is time. Not that you are owing them 3 months salary. No worker will be motivated under that kind of environment. And the next one, you ensure that there's a good work environment. There is a place to relax. There is a place to go to eat. There is a place, to make phone call and so on. Making sure that the environment is good. The environment is a good working environment. The next one is the skill mix optimization. These are the things you do to ensure that you have a good staffing where all your workers are happy to do the job. This skill mix optimization simply means the use of a combination of professionals. You have doctors, you have nurses, you have community health workers, you have volunteers, you have medical lab scientists, and so on as needed. There is a mix. You also have the community workers who may not be any of these professionals, but they are there to help carry things, they are help to help control, they help to help do this and that, because they know the community very well. They are there to guide. Let's not go here, this area is dangerous, let's follow this path. Oh, this village, I know this village, I know the king, I know their houses. They take you because you are a stranger, you don't know those community. But a community worker, that a worker brought from that community to work with you, it could be the head of the young professional, it could be the head of the youth appointed by the king. They will make the job easy for you. So you need that skill mix optimization, and that's how you go about it. What are the common Nigerian challenges that we have found in the area of staffing? Number one, inadequate staff numbers, And then we see that most times you have the staff, but they don't have the skill. And those who have the skill, they are not applying, and you don't find them. Perhaps the information is not reaching them. So those are the challenges, the common challenges we find in Nigeria when it comes to staffing. So let's see an example of staffing. An example is the polio eradication initiative, where polio, the plan to eradicate polio from Nigeria. That's a project, and they needed to employ staffs. Now, the success of it, at the time they did it, was linked to the certain or the caliber of staff that were employed. You have the district staff nurses, they were there. You have the vaccinators, you have the surveillance officers, community informants, they were all there. And because these were the essential hands that were needed, it made the project successful. In fact, one of the lessons learned is that strategic staffing improves outcomes even in difficult settings, because you have strategically brought in the right people. One way or the other, when the problem comes, they're able to surmount the problem. They're able to overcome the problem. So that is very, very important. We must understand that. We move to the next one, which is directing. Directing focuses on providing leadership, supervision, and guidance so that staff execute their task effectively. Now, this is the human energy of a program. That's where we consume a lot of energy. You spend a lot of energy because you have to direct. You have to provide leadership. You have to supervise. You have to guide so that the task is executed specifically, effectively, as planned. So what are the key elements of directing? Number one, supportive supervision. This is not a kind of punitive supervision. If you don't do it well, I'm going to punish you. If you don't do it well, I will make sure that your salary is reduced. No, this is not about punitive supervision. This involves observing the workers, mentoring them, solving their problems, providing feedback, and demonstrating techniques. Demonstrating what? Techniques. You look at them. You show them that, oh, I know these things too, but I cannot be doing it and supervising everywhere, but you can direct them. This is how we can solve the problem. This is the feedback. This is the technique needed to get this job done. Number two is effective communication systems. You have to put that in place. If you want to direct successfully, you need to do what? Provide effective communication system. This is where you provide clear reporting lines so that it will prevent confusion. When you communicate clearly. This includes daily briefings, WhatsApp groups, memos, dashboards, and field updates. Apart from effective communication systems, we need motivation. Don't forget you are directing. In directing, it's good to motivate them. Yeah, you're doing very well. Good, you're working as planned. Just be careful about this area. Wow, this is excellent. How did you do it? Wow, this is great. You motivate them. Workers perform better when they feel valued. When they feel that the supervisor recognizes them, values them. When they speak, you don't shut them down. You don't make them feel like they are irrelevant. This can be through recognition, giving of rewards, giving responsibilities, or providing opportunities for them to showcase their skill. Another way of successfully directing is taking decision making. These are timely decisions that needs to be done at every particular time because it is essential. I know these timely decisions are very, very critical, especially in emergencies. So you must have a good adaptive decision-making skill. Very, very important. Let's look at another example of directing. During the COVID-19 response, we had daily briefings from Abuja. We were watching it online. We saw that the directing from Abuja was evident and all health officials, institutions were listening. After that, they go and implement. So directing was evident in the daily coordination meetings that was taking place with the Ministry of Health, the heads of primary health centers, and so on. There were real-time dissemination of guidelines. This is the update. This is the new drug treatment plan. We had rapid adjustment of testing protocols. So protocols have been tested already in Abuja. And so we are told, don't waste time, implement it this way. They've done the job. And then we had continuous supervision of contract tracers. Those who have been sent to go and meet those who have been seen to have come in contact with those with COVID-19, where they lived, where they are hiding, we were getting reports. And that report had the way of providing confidence. Okay, this person has been seen, he has now been taken in, and this person has been quarantined. So what are the lessons? Directing keeps the program moving, and it prevents breakdown during complex or rapidly evolving outbreaks. Directing is very important. It keeps the program moving, it keeps it on, and it prevents breakdown during complex or rapidly evolving outbreaks. The next one is controlling. Controlling. And you can see quality assurance function. That's what controlling does. Controlling ensures that the program stays on track and that the deviations from the plan are corrected early. It is the quality control system of public health. We will see the key components of controlling right now. Haven't seen the importance of controlling. How can we carry out controlling? What are the components of controlling? Number one, setting indicators. This is what we want to achieve, and this is how we know. These are the signs that we show if they are achieving it positively or not achieving the goals. For example, in the antenatal care attendance rate, that rate will help you know if a lot of pregnant women are coming to utilize the services provided at the public health centers. So when you look at the antenatal care attendance rate, that will tell you if many pregnant women are coming, if they are coming to the healthcare center. When you see that, okay, 10% today, 30% tomorrow, and all, good. That is a good indication. How about immunization coverage? How far? How much of coverage have we made, achieved from one local government to another when it comes to immunization? How about HIV virus suppression? We carry out the CD4 count and we see that it's improving while the patient is taking the drugs. TB case detection rate, how about that? We are now able to detect TB more often than as it were before. That will tell you whether the program is being controlled positively or is giving a negative outcome, because this detection rate will help you know if the program is achieving its goal, because we are expected to see the detection rate to be low, because if the number of detections keeps increasing spirally, it simply means that the program is not achieving its goal. And so people are still coming down with tuberculosis, and this disease is being transferred communicably to one person to another. It means people are not taking the necessary caution and measures to ensure that this disease does not affect them. Or the rate at which people are contacting the tuberculosis is reduced. So we have a low case detection level. That's a TB case detection rate becomes low. That's when you know that, yes, by these are indicators that will help you know if indeed the program that you are controlling is indeed achieving its goals. The next one is monitoring progress. Remember, we are looking at the key components of controlling. The key components of controlling. So the first one we have seen, setting indicators. Number 2, monitoring progress. And you can do a fantastic controlling by monitoring the progress through routine data review. Check the report of the supervisors from each of the units. Check the dashboard. Maybe there's an information paste there. Do supervisory visits. Don't sit in the headquarter office. You move to the different offices, the different, implementation sites, building sites, project sites, to go and see what is going on. And also, you can monitor the progress through monthly review meetings. You call everybody together every month and say there's a meeting. We want to review all the activities we have done since the beginning of the project this month. As part of controlling, the components include also identifying deviations. Identifying what? Deviations. Identifying deviations. Because early detection prevents disaster. When we detect it earlier, it will prevent disaster. I'm sure you got that clearly. Very, very good. Now, we will now go into some examples of early detection. Vaccine stockout, knowing that the vaccines will still be, finishing in the store. And so, how many do we have? At what point do we need to stock in? How about poor case reporting? You check it, this report, this is wrong, this is not according to plan, and so on. absentee health workers. You begin to know there are health workers who are not on duty, who feel that because a lot of people are here, you won't know that I'm not around. But when you do an early detection, you carry out checks, you will know that workers are absenting themselves. Also, low community turnout. That's another example where you identify deviations. That's this community is not turning out for this project. Now, when you have observed all this, you have identified all these deviations, the next thing you do is corrective action. Number one, you retrain your staff so that they will understand the importance of not absenting themselves from duty. They will understand the importance of what they do. This is very, very important. And you will find out that they will be able to ensure that as much as possible, they join you in believing in the assignments that you have given to them. Not doubting it. You get it? Not, how will I put it now? Underrating it. It is very, very important. So, we have seen that, and that is that about controlling. And like I said, you take the measures, retrain the staff. Now they believed in your project, they've owned the project, they are no longer going to misbehave. Then you look at the strategy. Is there a problem with the strategy? Do we need to change the strategy? Do we need to reallocate resources? Is it that the resources is not enough? Or is it intensifying supervision? Intensifying supervision. So that is that. Now, let's look at some examples. An example is the HIV program in Nigeria. And there we saw that in the manner of controlling, the goal was virus suppression monitoring, which took place to ensure that in the patients, as they take the drug, the CD4 count will increase and the viral loads will go down. That is the virus. As part of controlling, it's also investigation of performance drops and then corrective actions. So you control by watching out for these indicators, because these indicators will let you know whether things are going fine or not, so you can guide immediately before it gets out of hand. And what are the lessons here? Monitoring prevents systemic failure. When there's a constant monitoring, before what will lead to systemic failure will take place, you would have made it on the board. Very important. So let's see, leadership in public health. Leadership in public health. This is the very backbone of effective implementation. Very backbone. And take note, it is behavioral, not just positional. How you conduct yourself with them, how you relate with the workers, how you talk to them, how you encourage them, how they see you, they will react to it. So be careful as a leader, you portray yourself in such a way that is accepted by your subordinates. So it's not just about I am the boss, I am the supervisor. No. So it is a lot behavioral, because leaders inspire commitment. Leaders navigate politics. They uphold the ethics. They are not found to be double standard, because the leader's wrongdoing becomes everybody's culture. So if the leader is found to be corrupt, the workers too will become corrupt. And also, the leaders sustain momentum because they give direction. So that's is all about leadership in public health. So let's look at leadership in program delivery now. Leadership in program delivery. At this juncture, we'll be looking at leadership styles. I've told you leadership is very important. Leadership creates or brings direction and ensures that the people, cooperate, work with you. You show that empathy, you show that unique, approach that makes every worker, every staff around you delighted to be in that project. Beyond just that, there are many other jobs, many other roles that the leadership must bring forth, must play. So leadership styles include the following. Number one, transformational leadership. Number two, transactional leadership. Number three, participatory leadership. And number four, situational leadership. So leadership cuts across all management functions. It's not about position. It's about influence, clarity of vision, emotional intelligence, and it's about ethical responsibility. So what are the types of leadership in public health? One will begin with transformational leadership. This is the type that inspires team members to innovate and exceed expectation. And this is very useful in the health reforms. Very, very useful. Number two, you have the transactional leadership. This kind of leadership focuses on rules, standards, and performance targets. This is useful in structured programs like immunization. Yes, very useful in structured programs like immunization. Why? Because the transactional leadership, it's not after inspiring you. It's just, look, what we have is a contract. You have been employed. These are the rules. Abide by the rules. These are the standards. Stay by the standard. This is the performance target. I don't know how you want to do, but make sure you get it done. This kind of leadership, transactional leadership, is useful in structured program like immunization. No time to play, no time to just get the job done. The next one is participatory leadership. This engages team members in decision making, successful in community-driven programs like control of malaria, onchocerciasis, and so on. Because it's participatory leadership, it wants everybody in the team to be part of the program. I want you to participate. I want you to talk at the meeting. It wants everybody to be part of it. In other words, it wants them to be among the decision-making events. It encourages the team and all the community to make input. Tell us what you think. Give us your idea. So you find that in certain community-driven projects. Then you have the next one, situational leadership. Situational leadership. These adapt leadership style depending on context outbreak versus routine activities. A situational leadership is a form of adapted leadership style depending on the situation. We now know which one to bring in. Maybe transformational leadership because we want to inspire innovation, want to inspire excellence, want to encourage the people to stand and do their job with all of their heart. Or perhaps it's a transactional leadership because we want to emphasize that it must be by the rule, by the standard operating procedures, and we must meet with our target. no targets, no funding. That is no salary. Or I want everybody to be involved. Participatory leadership. I want everyone to be involved. So you see that these are the different kind of leadership style which is warranted by the particular case or situation or project on ground. So we have WHO position on leadership, because WHO identifies leadership as a central building block of health system. WHO does not joke with it. And leaders appointed by WHO are well paid in pounds, dollars, and not just they are well paid. Just working with WHO for only 10 years is equivalent to somebody who has worked with the federal government for the past 25 years. Yes. You don't need to work anywhere else. You can just retire after working for WHO, UNICEF, and all those big organizations. Because all these leadership styles, you see them show it forth to their worker. And so every staff is happy doing what they're doing. So WHO identifies leadership as a central building block of health systems, because it is essential for governance, it's essential for accountability, and it is very important in making decisions. Very important decisions. Now we want to look at public health importance. So let us see the public health importance. Why is leadership very important? So effective management reduces maternal mortality. Yes, because when you say public health relevance, we're simply saying that strong management is able to directly improve certain aspects of areas, especially in every project where it is applied. For example, you see that strong management directly improves maternal health outcomes, malaria reduction. These are good examples. HIV virus suppression, immunization coverage, quality of service delivery. So in Nigeria, many programs fails because of lack of organizing, because of lack of staffing, because of lack of directing or controlling or leadership. Or perhaps we may put it this way, maybe due to weak organizing, weak staffing, weak directing, weak controlling, weak leadership, but not necessarily lack of fund. Because there are some projects that despite the availability of fund, it still failed. So programs rise or fall on the strength of their management. So if they are well managed, that is huge success. So let's look at country-specific examples. If you take note, we'll be treating a lot of examples, because these things without examples will only look like mirage. And so I've tried to make sure I bring in local examples now in Nigeria, not abroad now. I've been talking about local so that you can, when you hear these examples, when you hear them on news, when you read them on paper, it will make a lot of sense. So let's look at country-specific examples. Number one, the expanded program on immunization had a huge success, and the success depended on well-organized cold chain. They needed to put all the the vaccines in a very cold chain storage. So there was a well-organized cold chain. Generators were available, or solar panel freezers were available. Clearly daily directives. They were giving them directive what to do, how to go about it. They were telling them. And so we saw that the immunization program was successful because they had robust monitoring. Supervisors were everywhere, monitoring what was going on, how they were doing it, how many children were reached, and ensuring that they reach every ages 1 to 5 in every community. Another project is the TB Dots Clinic, that is the tuberculosis. The director says test for tuberculosis in the clinics. It was successful. Also, now the clinics required skilled laboratory workers. They required consistent supervision. They required strong monitoring tools, and they got those things. And that's why they succeeded. How about that of the onchocerciasis control? That's the control of the kind of worm infestation in that community. A disease. It succeeded because there was community-directed treatment model, one of the best examples of participatory leadership in Africa. It succeeded because they put in place one of the best examples of participatory leadership. Everybody be involved. You see this sign, come to the public health center. You see this, come to the public health center. People were encouraged. They were really, really, really encouraged. Really, really encouraged. So that's it. They were all really, really encouraged. So that's how this example succeeded. So the immunization program, a success. The TB clinic, tuberculosis clinic was a success. The onchocerciasis control was also a success because it required organizing, it required staffing, directing, controlling, leadership, and people were really involved. People really took part. People enjoyed doing it. The workers, the staff, all that were needed were put in place. So, what happened? What happened? When we say, okay, it succeeded, let's look at the analysis. A state receives funding to improve antenatal care uptake after 6 months. I'm giving a scenario now, so listen to this scenario. A state receives funding to improve ANC uptake after 6 months. And then they observed that there was poor attendance, staff absenteeism, vaccine was, exhausted, stockouts no longer available, and then they had irregular community outreach. People were no longer going to the communities as at when due, the right date, and so on. They were just doing whatever they like. So what were the management failures? Number one, organizing failed because we could see that there were unclear rules. There were weak supply planning. The people who were organizing really didn't organize properly. There were ambiguity rules. People were just doing the same thing, repeating themselves, and staffing. They were insufficient or demotivated workforce. They were tired. People stopped working because perhaps they weren't encouraged, they weren't recognized, they weren't rewarded. We saw that in terms of the directing, there were weak supervision and communication. Perhaps the wrong persons were put as supervisors to give direction. And they were also saw for controlling. They were delayed detection of problems. By the time they detected it, the whole thing had gone wrong. And this was how we observed management failure by function. So these are the outcomes. What happened? Because we observed management failure. And remember, these are the functions. So these things happened which led to the failure of that management, or the management of that project. Now let's look at the lessons learned. We learned that funding alone does not guarantee success. Supervision and feedback are critical. Role clarity is very essential. Let everybody know their roles. Monitoring saves the program. You set up a project, you are not there to monitor it, it's going to fail. So monitoring saves program. So what's the conclusion? Public health programs will succeed when the structure is clear, when the workforce is competent, and leadership is intentional, supervision is supportive, and monitoring drives continuous improvement. The science of public health gives us what to do. Program implementation and management functions give us how to do it effectively. So this is very, very important. We need to understand this. Once this is in place, then the rest assured that program implementation and management function will be a huge success. The project, the outcome will be a huge success. So now let's see another case scenario. Of all that we have discussed, let's see the way it was applied. Now, this case scenario, will be for you. It will be for you to go and work on. So this is a case scenario. So let's look at it. A state ministry of health receives funding to improve antenatal care uptake across 10 local government areas. After 6 months monitoring, reports show poor attendance, staff absenteeism, vaccine stockouts, and inconsistent community outreach. Now, I want you to identify how each management function, that is organizing, staffing, directing, and controlling, may have contributed to the implementation failure. I want you to do what? I want you to identify how each management function, organizing, staffing, directing, and controlling, may have contributed to the implementation failure. Now, this case scenario is an assignment for you. You are to carry out the activity, write it. You don't need to write and submit to my office. No. Under this YouTube video, type the comments there. Write your answers there. And don't put your name, just put your mat number. That's all. I repeat, do not put your name, just put your mat number, your matric number. I will let you know the deadline, and after that day, I will go and take account of all those who wrote. I will read through and I will take my score. So this is an assignment. You are to answer it. Type your results as a comment under this video. Take notes about that. The next one, we'll see the discussion questions. We have learned a lot, so let's see. Number one, why does good planning often fail during implementation in public health programs? Why? Of course, from what we have learned, good planning often fails during implementation because of weak execution system. From the slide, we saw that implementation is dynamic and adaptive to field realities. Failures occur when plans are not translated into concrete actions, such as proper deployment of health workers, logistics, and supervision. So common problems include staff absenteeism, poor community engagement, and supply stockouts. So without effective communication, effective coordination and monitoring, even strong plans, like you all know, will collapse in the field. In short, good plans fail when organizing, staffing, supervision, and logistics are weak during execution. So that's it. Question number 2, how do organizing and staffing interact to influence program success? How do organizing and staffing interact to influence program success? Organizing and staffing are interdependent management functions, because organizing defines the structure, I told you, the hierarchy, and the clear rules. Everybody knows who is their boss, who is their subordinates. They know the structure, they know the hierarchy, they know their role. Consider it in slide 11. Staffing ensures those roles are filled with competent and motivated personnel. You can see that in slide 13. And when the both of them are strong, there is role clarity, there is effective coordination, timely service delivery, like you saw with the National Malaria Eradication Program and Polio Eradication Initiative in slides 12 and 14. Now, weak organization leads to confusion because people don't know what to do and there's nobody to really direct them. While poor staffing results in low capacity, there is work to do, but does not know how to go about it because he doesn't have the capacity. Even with a good structure, you can have poor staffing. Poor staffing. So in short, in conclusion, for question 2, organizing provides the structure, staffing fills it with people. Both are essential for functioning or functional implementation. Question 3. Why is directing especially important during outbreaks or emergencies? Why? Why is directing especially important during outbreaks or emergencies? Directing is critical during emergencies because it will ensure real-time communication, like we saw in the case of COVID-19. Every day by 12 o'clock to 2 o'clock from Abuja, everybody connects to get the next instruction every day during the crisis. Because it ensures real-time communication, it ensures that the workers are motivated, it ensures that coordination is done under pressure. Coordination will still continue. So directing involves supportive supervision. Clear communication is given. People are motivated and adaptive decision making is taking place from time to time. So in crises like the COVID-19 response, daily briefings were taking place, protocol updates were taking place, and feedback loops kept all the teams aligned, including myself then, because I was one of the officers that was trained to train others. And so we were in charge of the tracing team. It helps overcome panic. It prevents misinformation because we're always available to correct every misinformation. And also, it will prevent fatigue, tiredness, confusion among staff. In conclusion, for number 3, strong directing keeps the teams focused and responsive when quick decisions and morale are mostly needed. Strong directing keeps the teams focused and very responsive when quick decisions and morale are most needed. Number 4, in what ways does weak controlling contribute to service delivery failure? In what ways does a weak controlling contribute to service delivery failure? That's simple. Weak controlling undermines quality. When you are controlling weakly, you are not controlling effectively. The indicators are not properly put in place and you are not monitoring. It undermines quality. It undermines accountability. Because controlling ensures monitoring performance, comparing results with your plan, and seeing whether there are deviations and ensuring that you correct the deviation. So when controlling is weak, deviations go unnoticed, problems persist, and data-driven corrections are delayed. For example, In HIV programs, failure to monitor viral suppression can lead to systemic failure. That patient will die of HIV. And all the plans, whether the drugs are working or the treatments is working, you will not know. But when you monitor, you will know if the viral suppression is taking place. So in conclusion, for number 4, without effective control, poor performance and errors spread unchecked. Poor performance and error, they will spread unchecked and they will lead to service delivery collapse before you realize it. That takes us to number 5. How can leadership compensate for limited funding in Nigerian health programs? How can leadership compensate for limited funding in Nigerian health programs? Leadership compensates for funding gaps through innovation. Find a way to go about it. Through motivation, we can do this. We can't afford to stop this program now. And strategic coordination, we sit back, we strategize. Okay, let's stop this one for now. Let's achieve this one. That will be able to come back and achieve this one. That's strategic coordination. Because strong leaders inspire commitment, they navigate political realities, and they sustain momentum. You know, despite the resource constraints, you see that strong leadership still get the job done. So it's not about the resource constraint. It's about ensuring that the commitment is there. The realities are recognized and you navigate it politically, and then you sustain the momentum. They use participatory and transformational style. Get everybody involved. Let everybody own the project. And then transformational style in such a way that they make the people understand the dividends of that project when completed. So they mobilize the community, the partners, support. So good leadership ensures efficiency, accountability, and community ownership, making the program more sustainable. In fact, for number 5, effective leadership turns limited funds into meaningful action by maximizing human and community resources. Effective leadership turns limited funds into meaningful action by maximizing human and community resources. Let's now take number 6. Very simple questions, but you have to answer them the right way. Which management function is most critical at the community level, and why? I taught you that. Which management function is most critical at the community level, and why? Remember that at the community level, directing is often the most critical function to direct, because it involves motivating and guiding the field workers, ensuring communication between local teams and higher authorities, doing outreach or immunization campaigns, supportive supervision and feedback drive participation, and it drives quality. But if that direction is not there, that directive is not there, the supportive supervision will not be there, and there will be no feedback. So you see, leadership also plays a major complementary role in maintaining community trust and participation. As a matter of fact, directing is most critical at the community level because it ensures local teams stay connected, motivated, and responsive to field challenges. I believe we have covered these questions 1, 2, 3, 4, 5, 6. I will advise you as a student to take note of these questions very well. Know them very well. Once you can answer these questions, you are good to go. It shows your mastery of this course. So I'm sure you wrote them down, the answers. Take note of them. I've given them to you. I've explained them. We'll now move to examples of the MCQs, like you meet them in the exam. Number 1, program implementation refers to what? A, writing policy documents. B, turning plans into operational activities. C, conducting evaluation only. D, fundraising. Of course, you know the answer there. Program implementation refers to turning plans into operational activities. Beyond paper, you make it a reality. Number 2, which management function focuses on supervision and motivation? I've just told you that the two of them go hand in hand. Supervision and motivation. When we're talking about management function, the answer is directing. Because in directing, you are going to do what? Supervise, and you are going to motivate the people. Number 3, monitoring viral suppression in HIV program is an example of what? Controlling. Because in controlling, you set up the indicator, you monitor if you are achieving your goal according to the set plan. So these are the kind of MCQs that you would be seeing. So let's see number 4. Equity in public health management primarily ensures equal salaries for staff. Is that true? More funding for urban programs? Fair access to services? Faster reporting? No. The word fair already qualifies for equity. Fair access. Everybody, whether you are rich, whether you are poor, whether you are big, whether you are small, male or female, everybody will have fair access to what? Services. Number 5 is participatory leadership is most effective in military operation. Remember, participatory is ensuring that everybody comes to join, everybody takes part. Is it in military operation or community directed interventions or emergency lockdowns or laboratory quality control? Of course, you know the answer. Participatory leadership, very effective when it comes to community projects, community directed interventions. All right, so these are short questions. So these short questions is also an assignment. So remember that you are doing the case scenario. You are to submit it as comment under the video. Do not put your name. You are to put just your matric number. After the case scenario, you are to also do the assignment on short questions. Number 1, divide program implementation in public health. Number 2, state 2 consequences of poor staffing in health programs. Number 3, explain directing using a Nigerian example. Number 4, why is controlling important in immunization programs? Number 5, describe one leadership style relevant to community health programs. This particular assignment, you are to do it on the same YouTube page. You write it, you type it, and when you've done that, you then post it there. Remember again, do not put your name, simply put your mat number. Do not put your name, simply put your mat number. It's easier for me to just open and begin to scroll through the comments. Then I will take my attendance sheet and then I will take my results. So that will be that for this course. I'm sure you enjoyed it. These are the references. Thank you very much. Take note of these textbooks. I will recognize, I will really encourage you to get this one, Introduction to Public Health in Nigeria by Adeyemo Olumide and Ajo. It was written in 2019. And also the Oxford textbook of Global Public Health, that's the best so far, 2021. You have the Essentials of Public Health, that Jones and Bartlett in 2022. You can get those textbooks. They're very much available so that you can read them and get more understanding. I want to thank you for taking time to watch this video. Of course, you know it's very essential. And this is the class for this topic. And remember to do your assignments. I'll be back online on the day of your lecture and at the particular time to take note of the attendance. I'll be in class in the subsequent one, and there I will take all questions, and I will ensure that we follow up on the assignments that have been asked that you submit, because that should be done before the day I appear in class. Once again, I wish you all the best in learning. Take care and God bless you. My name is Dr. Henry Aisaboy. See you in the next class. Part 2 of this topic. Bye.